Hello everyone, what should I say, g'day. Welcome to another episode of Meet the Penis. I'm Dr. Ross Calopedos, filling in for Dr. Perito this week, and this is MTP number 91. I'm a urologist from Sydney, Australia, and I'm excited to be here. Today we're going to discuss an important topic that affects many men, and those are the early signs of erectile dysfunction, or ED. Now, we wanted to talk about this because a lot of men don't know when this is happening. They think, well, I don't have a dysfunction. That sounds terrible. Of course it does. I can still mount somewhat of an erection. But we do know that getting treated early not only helps the patient psychologically and physically, but it also prevents long-term side effects like penile shortening. Sign number 1, reduced sensitivity. Now, of course, this can be due to several factors, including nerve damage from conditions like diabetes or medications, potentially previous prostate surgery. But if you notice that the level of sensitivity has decreased, it might be an early sign of ED. Not a causative factor, but something that's associated with an underlying problem. Sign number 2 is noticing that certain foods might trigger the penis not rising to the occasion. Diet plays a significant role in our overall health, sure, including our sexual health. High-fat foods, excessive sugar, processed foods can negatively impact our blood flow and testosterone levels too, leading to difficulties in maintaining an erection. Sign number 3 is related to alcohol consumption. While we might think that drinking 1 or 2 might help you relax, excess alcohol can depress the central nervous system, impairing the signals between the brain and the penis, which are necessary for an erection. Some people like to call this whiskey dick. Obviously, if you're having trouble after drinking, it might be a sign of erectile dysfunction. However, if you're drinking excessively or partaking in recreational drugs as well, it might mean that the penis isn't going to work for that evening and is otherwise all right. Sign number 4 is key. Experiencing morning erections less frequently. Now, we all remember the morning glory we had at the age of 14. These are normal. They're a normal part of healthy male physiology. And if you notice that there's a significant decrease in their frequency or firmness, this could indicate an underlying issue. And this is one of the first telltale signs. Lastly, sign number 5 is reduced libido or sex drive. Now, sexual experience and desire is a complex mechanism and it's tied in with our ability to maintain an erection. So if you notice a drop in sexual function, it may be linked to erectile dysfunction. It might mean that because there's issues there, you're withdrawing from that experience. Or it could be a hormonal issue. All of these things are not in your head. They're a problem down here. If you're experiencing any of these signs, it's important to consult with a healthcare professional because, as we said, early detection and intervention can make a huge difference in your life. Thank you for joining me today on Meet the Penis. If you have any questions or need any further information, don't hesitate to reach out to us or visit our website. Make sure you like, subscribe, and hit the bell icon to stay updated with our latest episodes. See you next time.